Dr. Parkes, thank you so much for taking the time today to answer our back to school questions. We know that there are parents out there with concerns as back to school is really around the corner. So you're really a very good person to speak to. Can you start by giving us your title, please?
Sure. I'm Dr. Leighanne Parkes. I'm an infectious disease specialist and medical microbiologist at the Jewish General Hospital in Montreal. I'm also assistant professor at McGill University, and I wear the hat of infection prevention and control at my hospital.
Wow. Okay. So the expert to speak to about this. So I guess my first question for you would be, what are some tips that you think parents, should be talking to their children about to ensure that as they head back to school, those kids are being as safe as possible?
Yeah, I think the same preventative means that we put into place, or we should put in place year round to prevent against any type of virus, would be something that I would counsel towards. So those would be the good practices of hand hygiene. And that's, after you go to the washroom, wash your hands. Before you eat or touch your face, wash your hands. And pretty much any time in between when you're touching another person's secretions, or another person's environment, you should really wash your hands. And that is essential to prevent any type of contact, transmission of any pathogens. And that's to say, when you touch a space that's contaminated with a virus, and then touch your eyes, nose, or mouth, which are our portals of entry. So that cuts that chain in the link of transmission. Other important sort of things that we can maximize on are cleaning one's space. So if you are given the opportunity to wipe down your workspace, that reduces the burden of any potential infection around you. And it's always good to teach children to take ownership of those things very young. And the last thing is to prevent any type of droplet transmission. So wearing masks and getting used to wearing a mask, which can be very difficult, even as an adult, to learn how to tolerate keeping a mask on for a prolonged period of time can be trying. But certainly, using types of activities like watching a TV show while wearing a mask and getting used to the feeling of having something on your face. As well as used to the idea of changing your mask frequently if it becomes very damp or soiled, into a new mask to really prevent any types of droplets from other people from getting into your nose or mouth.
Oh, that's a good point as well with the changing the mask. So would you say that it's a good idea, perhaps, because we know that under Quebec's new back to school plan, kids as of grade 5 as well as staff have to wear a mask in common areas. So is it a good idea to send your child maybe to school with an extra mask, and so they could change it if it is feeling damp?
Yeah, I think it's the same principle. If you send kids to school with extra gym clothes or extra, snow pants or extra hats or mittens, having extra masks are always important, in case you lose one, forget it on the bus, or in case it becomes too damp to actually protect you from anything.
Now, you mentioned the bus there, and we know, we've taken the bus from when we were in school. The buses are not very wide. A seat is probably about a meter wide, and there's going to be 2 students per seat. So the social distancing in that case is going to be quite difficult. Would you say that it's a good idea for kids maybe younger than grade 5 to also consider wearing a mask in a space like that where it's more confined?
Yeah, I think if there's anything, if it's tolerable to wear a mask, that's always a good means of protection, but there are always layers to protection. So on a school bus, certainly not during winter, but during more temperate days, having all the windows open enhances ventilation. So any small droplets that could be produced can be whisked away by wind and on air currents. So that can reduce the burden of any virus in that space. Also, maintaining the same person that you're sitting next to and the same people, so the same seat assignment, reduces the amount of transmission to other people. Because if you're kind of clustered within a bubble on your bus, you're unlikely to really infect other people. You'll only infect the same cluster or same bubble of people. So I think if you can have those different strategies in addition to enhancing ventilation, cleaning of surfaces, and if possible, masking, that's really important. They're all very important steps in an overarching plan.
Now we know that some parents wanted the power to make the decision to keep their kids home for remote learning. We know that there's a lawsuit right now by Julius Gray and some parents to try and obtain that. So there's going to be parents in a situation likely where they are sending their kids to school, but they have like real concerns and reservations, but they're not in a position to be able to keep the kids at home. So I guess what would you say to those parents today to maybe try and appease some of that anxiety as to why, it is a good step to send our kids to school?
I think the first thing would be to speak to the school, the individual school, to see really concretely what their plan is to prevent any type of transmission. Because if there is a good, solid plan in place that involves things from the upper tier of our prevention pyramid down to the very small tier, which is the masking, then that's really important. So if there's steps like improving ventilation, ensuring that you have adequate number of air changes within that space, that you have a low density of students within a classroom, that there's no mass gatherings to enhance any type of transmission events, that the environment's very well cleaned, that social distancing is respected, that masking is used, that there's a very a priori and well thought out plan for how do we screen for any signs or symptoms of COVID, and how do we rapidly isolate and implement testing if necessary to detect early outbreaks. I think if you have all that in place, particularly when community transmission is very low, then return to school can be something safe if done well, if well thought out, and if there is not a lot of community transmission. We can really learn from some of the models that were used and were successfully used in places like some of Scandinavian Europe, where return to school was very successful. And we can also learn from times where it wasn't very successful, such as in Israel, where there was a very rapid return to school. There was a community surge at the same time, and there was a high density of students within classrooms. So you really did have a very kind of like a perfect storm for transmission. So I think knowing the plan is really important, and knowing that our rates of community transmission are low is also really important. But again, if that changes, it's something that we have to reevaluate. These things always have to be fluid.
Yeah, and COVID-19, the reality of it is there's still a lot of unknowns. But from what we have seen, would you say that a child who does not have another underlying health issue that may put that child more at risk, it seems like what we're seeing is that they're not the age group that is more at risk of becoming very sick from COVID-19. Is that true from what we've been seeing?
Yeah, I think there's two sort of aspects to return to school. One is the risk to the individual child. And certainly we know that children that have underlying medical conditions, as well as infants under the age of 1, are at risk for more severe disease. And there's a small subset that gets a Kawasaki-like illness. It's a inflammatory condition that can affect many different organs. We can't predict which children get this. And it's a very small proportion of individuals that do get this, but it is still a very severe consequence or sequelae of COVID. So that's the individual risk. But then there's also the secondary risk to the community and to other individuals that might be in contact with children that might have mild disease or be asymptomatic, but spread to immunocompromised individuals in their household or within their community. So if you think of a school as kind of the island of Montreal at the very beginning of the COVID outbreak, it's relatively untouched by COVID, but we had all the spring break returners coming in, and that's all the students coming from their respective neighborhoods and households. Some of them might have been exposed to COVID there. So you're going to import COVID into the school, which is a relatively closed community. You're more likely to be in a population where you're going to intermingle, not respect social or distancing norms because you're a kid and you like to boop other kids on the head and share secretions and all the things that kids do.
All the things kids do, yeah.
Exactly. And all of that will enhance the likelihood that you're going to have a tiny outbreak in that setting. And those students are going to go back to their respective communities and households and import or export the virus to those spaces, which can result in tiny outbreaks opening up elsewhere in the city. So that's the public health risk. That's the community risk of school reopening. So I think there's really two facets that have to be considered in safely reopening: the individual and the community risk.
And I think that there will be some responsibility on the parents to, maybe do some checks with their children as well, so that if there are some symptoms where that child may have COVID-19, that they're not allowing that child to go into the school and spread it. So particularly as it gets colder, which is not that far away in Montreal, and we're going to start having cold and flu seasons. What are some things that parents should look out for that, okay, if that's happening with your child this morning, it's a good idea to keep that child home?
Yeah, so it's a difficult question because the symptoms of COVID in children are pretty much indistinguishable from the symptoms of any other respiratory virus in children. Which is to say rhinorrhea, or like the stuffy runny nose, and cough and fever. Those things are pretty consistent throughout any type of virus. So it's very difficult to say, if you list these key symptoms, this is for sure COVID versus a run-of-the-mill coronavirus versus rhinovirus versus flu. But what is really important is doing that type of active surveillance, and at the first sense that there's an onset of symptoms, reaching out to medical providers to have access for testing to make sure it isn't COVID and it's not something else.
The other thing you mentioned there is proper ventilation. And as it does get cooler, we might not be able to have our windows open in class and stuff. So I know that's been a concern that some parents and some teachers have shared, that, in Montreal, the reality is we have older schools who sometimes those schools don't have the most up-to-date ventilation system. What would you say to those parents and to officials in terms of like the importance of ensuring we do have adequate ventilation?
Yeah, I think it's incredibly important, ventilation, as sort of the top base layer of our pyramid of prevention. Having those types of engineering controls or environmental controls to prevent the spread of COVID. We've seen, or we do have some experience in terms of outbreak analyses, as well as locally within our long-term care facilities with poor ventilation, that shows that inadequate ventilation can be a component that enhances an outbreak. It's not the be-all end-all. It's not going to be our saving grace, and it's not going to be, the nail in our coffin, but it's definitely a contributor that we have to certainly address. Specifically when you have a high density of people and a high concentration of virus, having adequate ventilation is essential to reduce the burden of the virus within that population, and to reduce any chance of transmission or a high attack rate or a super spreading event. So I think, I would definitely encourage all schools to verify the status of their ventilation, to ensure that it's adequate, that they have, intake of fresh air, and they have exhausting of air within that space. So there's constant changing of air to ensure that you do have ideally a good number of air changes per hour. So you have some removal of any type of small droplets from that space.
Okay. In terms of the doctor's notes that students can get, students that may be more at risk, if I know it might be difficult right now to start listing all the conditions that would fall because it's also someone close to the child that may be at risk. But what are some of the what are some conditions that parents should consider that, if your child, is autoimmune compromised, for example, that perhaps remote learning would be a good option for them?
Yeah, so as an adult infectious disease specialist, I'm probably not the best to answer about the individual diseases affecting children with respect to outside of the realm of infectious disease, but certainly any chronic condition that might suppress one's immune system or chronic conditions in general should be addressed with your primary care provider or the specialist that's following those conditions to see if it's something that would place that child at an increased risk for severe complications if they were to acquire COVID.
Okay, so if there are any parents that are not sure, the best step is probably to speak to your family doctor.
100%. Yeah.
Okay, I think that covers all of my questions. Is there anything that you would like to add?
No, I think that's pretty good.
Okay, thank you so much for your time.
It's no problem.